Well, the word of the day as we talk feet with Dr. Mark Bradley of Brantford Podiatry Associates is arthritis. Welcome back.
Nice to be here again.
Okay, let's do it right off the bat. Only 70-year-olds get problems with arthritis.
Correct.
Yeah.
That's it.
Come on.
Okay, so we got primarily two different types of arthritis that we deal with on a general basis. Well, osteoarthritis is the most common. I mean, essentially, all joints will eventually develop osteoarthritis, and as you say, once you hit 70, it magically appears.
So what is it? We got a name for it.
It's basically wear and tear.
Okay.
And as with any moving structure, if it's forced to work out of its normal position, you'll speed up that wear and tear. So once the joint actually develops osteoarthritis, we get a reduction in the amount of nice slippery cartilage there is between the bony surfaces. And at that point, the bone of the joint, basically around the edge of the joint, starts to develop new material. And I put a couple of little pictures together for you.
Yeah, I was going to ask you about cartilage. Here we go.
All right, so this is actually, oh, that's great. This is the osteoarthritis one. So here's an example of a foot that's been rolling in and the arch lowers. And as it lowers, the bone basically is pinching together, and where it repeatedly hits the two surfaces, it's actually laying down extra bone.
So cartilage is our shock absorber.
Shock absorber, and it's like Teflon coating.
Right.
It allows things to be all nice and slippery and glide. The problem is when you get those little growths, then you reduce the range of motion. You want to pop onto the next picture there. So this is an ankle joint, and again, normally there should be a nice space between the two bones that make up the ankle joint.
What's the aggravated space in the middle? Is that part of the problem?
Well, that basically is just the darker or the more dense white area you're looking at. There's actually just a more dense bone.
Right, okay.
But normally there should be a lovely gap because cartilage is about 90% water.
Right.
So it shows up as a nice clear space between the two bones, and it should be equal, a nice congruous surface right the way across. So when that deteriorates, then you get the wear and tear and the sensitivity and the new growth of bone on the side.
Well, you talked about cartilage being so much water. Do we run the risk when we're young if we're not taking in the fluids when we're working out of causing the problems later?
Absolutely, yeah. And also, when we're young and we're very active, increased activity, you can overdo activity. So that's why it's important with young athletes to moderate their activity levels. And again, body weight has a big impact on that. And as frames grow and they develop so much musculature at an early age with extra training, you can actually do damage.
Now, one of the things I've learned through working with the junior hockey team I work with, when we work out, we create little micro tears, and that's how muscle is grown, and we put in the right nutrients, we get muscle. But we're talking about more bones than anything else. Is there anything we can do to kind of create muscle? Or
nutrition's vitally important. Unfortunately, at this stage, we don't have the ability to recreate cartilage once it's gone. And there are lots of products on the market that supposedly will enhance cartilage development. As of yet, scientifically, we've not seen that actually produce any changes in the clinical setting.
So I'm having problems, the cartilage is aging, it's not there where it is. Now you diagnose I've got arthritis. What's next?
So the first thing is, as I mentioned earlier, there are things that can accelerate the problem. As we allow this cartilage to wear away, you're going to be in a worse situation. So the better aligned your joint structure is, the less quickly it'll wear away. If you can diminish the impact, if you can reduce weight, there's a whole bunch of different things that can be done. It's not simply I've got osteoarthritis, now I got to put up with it.
It almost sounds like to me like when Junior starts walking, if I don't get the right footwear, then I'm setting the stage for problems.
You certainly can do. And again, in the other more common, or not more common, but the other common type of arthropathy that we deal with is rheumatoid arthritis, which it's not an immune disorder, basically where you decide to destroy your own joints.
Okay.
Very similar situation. In its aggressive state, it's got to be controlled quite well, and they can do that with medication to lessen the damaging effects. But again, the mechanical component, how that joint's working, will greatly increase the load on it and make it more rapid, the destruction of these joints. And it can be horrifically destructive.
So it sounds like if I'm walking a lot, working out, whatever, I feel pain that's not normal, get an answer.
You find out very quickly what it is and at least diminish it. If it's not something we can put an end to, at least diminish the negative side of it.
Dr. Mark Bradley, thanks for the information as always.
Pleasure.
Coming back here, we're going to be around for a Wednesday, and that means Sid Bolton's going to join us. Also, have you heard about the Calendar Girls? I wonder if they're going to look like they did in Brant News.